Hello, my name is Saj Rambab. I'm one of the respiratory therapists at Morlen Health.
And I'm Ed Birnbaum, another respiratory therapist with Morlen Health.
And today we're going to discuss part of our Breathe Better 101 inhalation therapy. It's part of our pulmonary rehab educational series from Morlen Health Pulmonary Rehab.
So let's get right into it.
All right. There are three types of inhaled medication devices. You have a pressurized meter dose inhaler, commonly known as the MDI. There's dry powdered inhalers, commonly known as DPI, and there's nebulizers. So in the pictures here, you will see the different ones. So that right there, it's circled as a nebulizer. This one is the MDI, which is the most common one. And the second most common type of portable device is the dry powder inhaler.
Which come in many different shapes and sizes, but they have many things in common, and we'll explain that.
Now, the pressurized meter dose inhaler, or the MDI, when the valve is actuated, the propellant and the medication leave the inhaler at a high velocity. Majority of the medication impacts the oropharynx, or the back of the throat, and less than 25% reaches the lung. So that's why it's always recommended to use a valved holding chamber, also known as a spacer.
Which will put a lot more than 25% into the lung when used correctly. None of them will give you 100%, but you'll get a lot more of the medicine where it needs to go.
Now, a little word on the MDI propellants. This is a little bit of historical information. The medium in which the active ingredient is dissolved is what is called the propellant. Now, it provides the force to generate the aerosol cloud. In the olden days, so when I was younger, they used CFCs, which are fluorocarbons, which are were commonly used propellants. Now it's banned to the adverse effects on the ozone layer. Now they use HFAs, or hydrofluoroalkanes, which you'll see on most boxes. It'll say albuterol HFA, Venylin HFA, provenyl HFA. And it's more effective, and it produces an aerosol with smaller particle sizes, which improves the deposition in the smaller airways and provides greater efficacy.
So what's important about all that is that the gas that comes that's in the chamber of the inhaler is going to push the medicine out of the inhaler, and you need to then breathe it into your lungs. It's coming out whether you're breathing it in or not. Okay, it can go out in the air or it can go to the back of your throat. We'll tell you how to breathe it in so that you coordinate the inhalation that you do, breathing in as that gas is pushing the drops of medicine out, and you are inhaling them into your lungs.
Now, there are pros and cons with the MDI, and we'll talk about the pros and cons without the spacer, and then we'll talk about the pros and cons of the MDI with the spacer. So without the spacer, the advantages are it's compact, it's portable, it's convenient, multi-dose delivery capable, so you can have many doses, usually about a month or so of doses within a canister. Much lower risk of bacterial contamination, and it's suitable for emergency situation because it is has a propellant in there. The disadvantages: coordination of actuation and inhalation. It can be difficult for children and elderly patients to be coordinated. There's also high pharyngeal drug deposition, so the back of the throat, what we were talking about. And the remaining dose can be difficult to determine in some. Most all of them now have counters on them, so you'll be able to read how many remaining doses there are. There you might find the odd one, maybe it's a generic one that does not have a dose counter on it, but majority of them have dose counters on them. Now, with the spacer, or the aero chamber, or the valved holding chamber, there's many ways of discussing it. You should remove the cap, shake the inhaler, insert the inhaler into the spacer, breathe out fully, put the spacer in with the inhaler attached to it, actuate it, so press it, breathe it in nice and slow, nice smooth breath, and then hold your breath for about the count of 10 and breathe out nice and slow. One thing that has been a common misconception is that these valve holding chambers will make a noise similar to like a kazoo or a harmonica when you breathe in too fast. A lot of people think that that noise is supposed to happen, but that is incorrect. You are not supposed to hear that chamber make that noise. It's supposed to be just a smooth, nice inhalation, breath in and then the breath hold, and then breathe out nice and slow. Now, the pros and cons of the MDI with the spacer. Advantages: it helps compensate for poor technique or coordination with the MDI. It allows more medication to reach your lungs. Also, keep that in mind of the newer inhalers, because it will get into your lungs deeper and better. It prevents medication from escaping into the air. And there's fewer side effects from steroids or corticosteroids residue in the mouth. Because you have that spacer or that chamber or the valve holding chamber, when you're breathing in nice and slow, it follows the flow deep into your lungs, and it doesn't hit the back of your throat or your tongue as much. Disadvantages: it's a larger size and the volume of the device, so it's pretty clunky to carry around. We recommend keeping one in your car, maybe in your backpack, your purse, or if you have a bag that you take with you everywhere. And then bacterial contamination is possible, so you should clean the device periodically. And that goes with any kind of device as well. You should clean your mouthpiece on your MDI, and you should also clean the aero chamber, valve holding chamber, or the spacer periodically. Cleaning them, you wash the mouthpiece and the spacer in warm soapy water at least once a week, more frequent when you're sick. Dry carefully with a clean lint-free cloth. Wipe off the mouthpiece daily. Keep the cap on the mouthpiece when not in use. Do not share your inhaler or spacer with others, and have extra spacers on hand if possible. Sometimes we lose pieces, things get broken, something comes dislodged in the shuffle if you have it in your purse or in your backpack. So it's always nice to have one backup if possible. The single dose dry powder inhalers, or we call them DPIs, common examples are Spiriva and Foradil. They must be reloaded with a capsule containing the micronized medication in a large particle carrier powder. It contains just the medication, no propellant. So it's very inspiratory effort or breath in dependent. Now you have the multi-dose dry powder inhalers, where it's a medication is in the device. There's no capsule. Also, there's no propellant. So really here, when you see this number here, that's the counter. So you have 14 doses remaining in this Advair discus. So that's a big advantage of the other ones, because those are single dose at a time. You have to put the medication in it every time you're going to use it. This one, you can use it until the medication is over with in this device, and then throw it away. How to effectively use your DPI is you remove the cap, load a dose of medication in, or crack it open as opposed to the Advair discus if it has multiple doses. Turn your head and breathe out as much air as you can. Try to empty your lungs. Because remember, if you're exhaling your air into your device, for the dry powder inhaler device, that moisture can cause the powder to accumulate and settle out, and you don't want it to do that. You want it to get into your lungs, not stay in the device. Put the dry powder inhaler in your mouth, your lips firmly around the opening, and then using just your mouth, breathe in once, very deep and fast, and fill your lungs as deeply as you can. Never breathe into the inhaler. And then you can take your mouth off of the inhaler, hold your breath for a count of 10, and slowly breathe out. And if it is one that it causes or is indicated to take more than one dose, follow your prescriber's instructions and do that. Wait about a minute or two in between. And when you're done, make sure you cap it or take the used capsule out of it, close it, wipe off the mouthpiece if need be, and then rinse your mouth out. Even if it's not a steroid medication, that powder can settle on your tongue and the back of your throat. So we really recommend you swish and spit or gargle. I recommend all my patients is you do it right before you brush your teeth. So you take your dry powder inhaler, do it the proper technique, and then brush your teeth, and you're good to go for the rest of your day. Pros and cons of the dry powder inhaler: it's breath actuated as an advantage. Less patient coordination required. You don't have to coordinate it, right? Because you are just piercing the medication capsule, and then you're breathing in whenever you're ready. The spacer is not necessary, so it doesn't add that bulk. It's a little bit more compact and portable. No propellant involved in it, so it's technically better for the environment, especially if you're using the old chlorofluorocarbons. Usually provides higher lung deposition than a pressurized MDI, because you are generating all the pressure and the flow. It generally deposits in your lung better. Disadvantage: if you aren't able to take a good enough inhalation, you won't get the deposition that you're looking for. Most are moisture sensitive, so in high humid areas, don't keep it in the bathroom because it could clump the powder together. So try to keep it in a nice dry environment. And in single dose devices, you need to reload the capsule each time. Nebulizing, I put inhalers in quotes just to keep everything nice and simple. We want to keep things as inhaled and MDIs or inhalers as possible. It's actually a nebulizer. I have had people talk about nebulizing inhalers, which confused me at some point, but some people talk about it as nebulizing inhalers, some people talk about nebs, some talk about nebulizers. So I try to put all the terms on here so we cover all of our bases. But it changes the liquid medication into a fine mist to let you breathe it into your airways. It's given to help you breathe easier. The nebulizer equipment and medication must be prescribed by your doctor, although you can find most of these compressor units over the counter on Amazon, Walmart, almost all websites that you do your shopping on online will have them. How to effectively use your nebulizer. Of course, before you do it, you should wash your hands. And we stress this more with this because you are actually pouring a liquid into the nebulizer cup. So there is more chance of contamination. There's more gaps in the system per se. Connect your hose to the air compressor, fill the medicine cup with your prescription medication, close the medicine cup tightly to avoid spills. If it is one of the twist-on cups, make sure it's threaded correctly. Attach the hose and the mouthpiece or mask to the nebulizer. Sit up straight. It's very important to sit up as straight as possible. The more reclined you are, the less the medication will nebulize. So you might need to shake it up a little bit or angle the nebulizer to make sure that the liquid is facing to the bottom of the nebulizer cup. Place the mouthpiece in your mouth or the mask over your nose and face and breathe normally. We recommend that every maybe 5, 6, 7 breaths, take an extra deep breath in, hold your breath for about 3 to 5 seconds if possible, and then exhale nice and slow. It's better if you can exhale out through your nose, especially if it's a dry time of the year, because that saline can help moisten your mucous membranes in your nose, and it makes your breathing a little bit more easy and more comfortable. Usually takes about 10 to 15 minutes for each nebulized medication to complete. So the difference from hospital nebulizers to home nebulizers is we have a high pressure source in the hospital. In the home, it's a low pressure source compressor. So that's why it takes longer. Hospital, sometimes you can get away with 7 to 10 minutes, depending on the neb. At the home, generally 10 to 15 minutes is what it's going to take. Tap the medication cup several times to ensure all the medication is nebulized. You'll get some condensation at the upper part of the cup. So when you tap it, it just drops it down to the bottom, so you get all the medication. Turn off the machine when you're done and clean the nebulizer, mouthpiece, or mask. Remember to cough up and bring up the loose mucus at the end of your treatment. I have also recommended if you have a mucus clearing device, try to use it before and after. You want to give the medicine the best opportunity it has to get to your lungs. There's no point in giving medication to mucus. It's not going to do anything for your mucus. You want to get to your airways. Pros and cons of nebulizers. Advantages: it provides therapy for patients who cannot use other inhalation devices. It allows administration of large doses of medications. We have some cystic fibrosis patients who you take multiple vials of medication, and you can't do that in an inhaler. Patient coordination is not required. Can be used with supplemental oxygen. So if you wear oxygen at home, you could hook it up to your oxygen cylinder, maybe your compressor, your oxygen concentrator, definitely your backup cylinder. But again, if you're using those backup cylinders to deliver oxygen for your nebulizer treatment, you shouldn't do it routinely, but make sure you let your oxygen company know, because it could deplete your oxygen cylinder duration. Disadvantage is decreased portability, although they're getting smaller and smaller every year. Longer setup time and administration time. Higher cost, more so because of disposables. You have to get the nebulizer cups, the nebulizer kits. Electrical power sources required, so either battery operated some of them, the portable ones, and then you got to plug it in. And there's a higher risk of contamination because it is a liquid. Every time you have liquid, it's a bigger area for bacterial contamination to occur. Cleaning your nebulizer, it's very similar to your valved holding chamber. Rinse the nebulizer cup with warm water and shake off the excess water and let it air dry. At the end of the day, you can wash your nebulizer cup, a mask in warm soapy water using a mild detergent. We recommend Dove or Dawn, and just a little bit. A little bit goes a long way. Rinse thoroughly and allow to air dry. Don't clean the tubing because it's just too hard to get the water out of it. If you do want to keep your one nebulizer spare, which we do recommend, the best way to sterilize it is 1 part cheap distilled white vinegar, 3 parts tap water, put it in a container, throw the nebulizer cup in there after you've unscrewed it, let it soak for about 10 to 15 minutes, and then like maybe swish it around a little bit and then rinse it out really good with clean tap water and then let it air dry and then wrap it in a paper towel and then put it in a plastic zippered bag. And that way you have one that's basically clean and ready to go in case your new one that your DME company has given you breaks or you lose it or you lose a piece or it's just not working well or it cracks. Sometimes people twist on the top too hard and it just cracks the plastic. So it's good to have a couple handy. Now, the nebulizer storage, along with medication storage, is you should cover the compressor with a clean cloth when it's not in use or in its case. Medications should be stored in a cool, dry place. It is a compressor, so it's pulling in air from the outside. So you don't want to put it in a drawer because it does generate heat. You don't want to keep it where there's a lot of dust bunnies, a lot of pollen around. They usually have filters that you can either replace or wash out, air dry, and then put back in. So make sure those filters are clean because if they are not clean, if they're really dirty, they can impede the airflow into the device and really make it overheat and you get much less life out of your compressor. And then your medications should be, kept in a cool, dry place. Some of them should be out of the sunlight. They have special foil wrappers. So make sure you keep it in the wrappers as well. In conclusion, there are 3 types of main inhalation devices to help with pulmonary disease. Each has its advantages and disadvantages, and the key to successful treatment is proper inhalation technique, and proper cleaning techniques will decrease the risk of infection. An important reminder, we are in the middle of, or the start of cold and flu season, and also COVID season. We don't know if it's ever going to end. So definitely hand washing is the #1 way to decrease infections. So just wash your hands. We all know the steps. Just make sure your hands are clean. And then, we recommend flu shot, pneumonia, or COVID vaccines, and also other vaccines as per your doctor's recommendations.
All right.
Thank
And I
you.
would just like to add just a little bit. All 3 of these means of delivering respiratory medications have been shown to be equally effective if used correctly. So there's none is necessarily better than another, but people may have personal preferences, and also your what's accessible to you may vary depending on your provider and your insurance. But all of them are very effective. The nebulizer is used in hospitals partly because of tradition, partly because it's more difficult to teach people how to use them effectively under the setting in an emergency situation, when you come into the emergency room. But you may want to have a nebulizer available if you're using that kind of medication for when you're having an exacerbation of your underlying chronic respiratory disease, pulmonary disease. But whatever feels best to you is best for you. Okay.
Great points, Ed. Thank you so much for watching the video. We appreciate you taking the time, and we'll end it here. Thank you so much.